This morning, you'll see an additional tab in the dashboard that DHHR has been able to put up that focuses on individual counties. We've had a lot of questions about counties, concerns about inequities of distribution in counties. Please understand that early on in our process, based on our 4 principles, our focus was on healthcare workers and nursing home facilities and nursing home staff. So where there were concentrations of those facilities, you're going to see greater concentrations initially in the per 1,000 doses that have been administered. I want to make sure that people understand, and I've been at this a long time and been at this with the governor through his first term. We are focused on all of West Virginia, but we are focused on our principles, and that is going to impact our numbers initially. And the people in the JIADF represent all of West Virginia, and we'll continue to focus on that. But we know, based on what we have done and our strategy that the governor's focused us on, as Dr. Marsh pointed out recently, we have almost a 70% reduction in deaths in this state over the first 6 weeks of 2021. So we've got to continue to focus on that path. I want to also highlight how this will work going forward with our registration system. As the governor pointed out, over 137,000 West Virginians over the age of 65 have received a dose of the vaccine. We know that in West Virginia, by our census data, we have 367,000 people. We estimated initially that about 275,000 of those would take that, about 75%. That leaves us around 136,000 West Virginians. But today, we already have 109,000 West Virginians in our registration system. So if we can continue to press to get the rest of those West Virginians over 65 registered, and we now know where we need to focus those 109,000 doses to get those numbers where we need to be. And today, we also know that only 320 West Virginians are in the hospital with COVID. So I ask folks to continue to be patient. We will continue to focus. The governor continues to press us, not just on our principles, but on being transparent. And that's why we put those numbers up going forward. Thank you.